The budget is due to rise by £20 billion a year above inflation by 2023. All right, well, let's see how much hope we have for a 10-year NHS plan with Dr. Helen Salisbury, who is a GP in Oxford and a spokesperson for the National Health Action Party. And we'll take a perspective from Patricia Marquis in a minute, England's Director for the Royal College of Nursing, and Robert Colville as well, Director of the Centre for Policy Studies, as we look at the cash behind this. Dr. Salisbury, if I could start with you first and ask you how...
Good morning.
Hello. How optimistic are we? We have another plan. Everything's going to be fine.
We have another plan. Hurrah! I mean, the ambitions are very welcome. There's clearly quite a lot in there that's sensible. I don't agree with all of it, particularly things like improving the mental health service and a better transition from child to adult mental health service, which is a disaster at the moment.
Yeah.
But the problem is, the money doesn't quite match up. So we've been flatlining since 2010, and it's all been a bit of a disaster. And we're now going to go up to a 3.5 increase per year in NHS funding. So everyone's really pleased, except that all the serious health commentators like the King's Fund and the Nuffield Trust agree that we need a minimum of 4% a year. So the money's really, really useful to stop a complete disaster. But I don't know that we're going to achieve all the great shiny new things that are being held in front of us, because we just need this money not to fall over.
It's great that mental health is at the top of most people's agenda when it comes to improving healthcare, because frankly, you've got to be virtually dead before they'll even look at you if you've got, for instance, an eating disorder.
And you know, I refer people with eating disorders and they get seen 10, 11, 12 months later, which kind of hasn't really helped. If they're still alive, yes, absolutely. I mean, it's dire at the moment. And we desperately need that funding going in. But there's an awful lot of kind of detail that's left out. So we've got a 3.5 increase in NHS funding. We've got a 4% decrease in public health funding. So that's the money that goes to smoking cessation programs and weight management programs. And not kind of sexy in headline, but actually, if we want to prevent people getting ill, and the new Health Act keeps going on about this, then we actually do need to be putting some money into public health, into those prevention programs, but that's all been cut because it's now run by local councils, and local councils have lost 60p in every pound in government funding.
If I was to say to you, Dr. Helen Salisbury, if I was to say to you, you're a GP, when people take you for granted and your time for granted and your practice for granted, and then they don't turn up for appointments, if I was to say that you ought to charge them the so-and-so's 10 quid, would that make me an evil fascist?
Nah. Well, it might. I mean, it wouldn't make you evil, but it wouldn't make any sense, because
really,
actually,
it would stop people doing it, though, wouldn't it?
No, because people have difficult and chaotic lives and no money, and often can't turn up to things for no fault of their own. And the most vulnerable people are the people who have the most unpredictable lives and can't come.
Okay.
So, I mean,
how about if you're making 30 grand a year and plus, and you don't turn up, we're going to charge you 10 quid.
You see, the point about this wasting time or wasting assumes that the people whose time, when you don't come to that appointment, are sitting twiddling their thumbs doing nothing. If you don't turn up for your appointment, it may be that I get home at 9 p.m. rather than 9:30 p.m. I'm actually not always disappointed if there's a little gap, because I can just there's so much work to do.
I know.
But the problem we've got is that one problem is there's no plan without a staffing plan. And one of the major issues at the moment is we don't have enough staff.
Right.
They're leaving the country in droves. Actually, everywhere you look, there's a shortage of money and there's a huge shortage of staff.
God, you're not making me feel very good, Helen.
I'm sorry. I'm so sorry.
Doctor, you're supposed to make make me feel better.
Well, and just to make you feel a little bit worse even than that, we're meant to be having integrated health and social care, and the social care budgets have completely. So actually, if people are sitting at home and don't have anyone to look after them, if they're not being looked after, then they end up in hospital. They end up in hospital, not able to get out of hospital, and that bit hasn't been solved at all. And the social care budgets are still going down, not up.
We agree completely. And like Home First is so pathetically badly run. It's beyond belief. And so are so many hospitals. The geriatric wing at one hospital that we've been using in the last year. I mean, to say I think callous would be fair. But anyway, do you know what? That's another thing, and I have other people waiting. Helen, thank you. Appreciate your time.
You're welcome.
This morning. Patricia Marquis is England's director for the